Hi, this is Paul Chek. Welcome back to my video blogs. Hope you're enjoying them. If you are, share them. Share them. Today I'm going to teach you a corrective exercise that's the most effective exercise I've ever found in my career for stabilizing sacroiliac joint instabilities, which is very, very common. Actually, research shows that about 98% of patients with low back pain also have a concomitant SI joint dysfunction of some type. So low back pain and SI joint dysfunction pretty much go hand in hand for reasons I get into in the Chek Advanced Training Program, but won't bore you with the technical details other than to say the knee bone connected to the hip bone connected to the ... all the way from head to toe. Now, the abdominal wall and the pelvic floor down below are very, very involved in stabilizing the SI joint. As you can imagine, the pelvic floor helps hold the two halves of the pelvis. One half of the pelvis is called a hemipelvis. The ilium is here, ischium here, acetabulum is where the femur is. And so what happens is if we're not able to activate our abdominal wall naturally and effectively, which commonly happens due to unresolved back injury and back pain, to inflammation in the guts, particularly any of the organs in the distribution of the low back, such as the kidneys, the bladder, the sex organs, the sigmoid colon, and the small intestine can get involved because the abdominal wall acts on the whole abdominal wall from T5 down, acts across the whole system. So it's not just segmental relationships. The whole abdominal wall is involved in this. And as we're walking, our legs are swinging. So when our legs slinging, the SI joint, which is a fibrocartilaginous joint, acts like a clutch in a car. As you let your clutch out, the flywheel spinning on the engine engages the clutch, which engages the drivetrain. So when you're walking, as your foot strikes the ground, your abdominal wall contracts, your transverse abdominis pulls in, pulling the two halves of the hemipelvis together. And because you have sacroiliac ligaments running across the back, basically what you get is called the nutcracker effect. So if this was a nutcracker and the sacrum was a nut, so each ilium would be the jaws of the nutcracker, the walnut would be the sacrum, and the hinge on the nutcracker would be the SI joint ligaments that cross back here. As your foot's about to strike the ground, your transverse abdominis fires, your pelvic floor fires, your diaphragm fires, and the deep stabilizers of your spine fire. That's called the inner unit. And they pull the two halves of the pelvis together, creating stability on that joint on the stance side. So if that doesn't work, and by the way, research cited by Andre Vleeming showed it only takes 6 pounds of pressure to stabilize that SI joint due to the mechanical forces and the way it's designed. But if you don't have a functional abdominal wall, not only the things I mentioned, but things like parasite infections are a common thing that shut it down. Also surgical scars that get trigger points in them, or surgical wounds such as hysterectomies and C-sections, when they used to cut through all 3 layers and sew them back together, completely confuse the coordination of the separate layers of the abdominal wall. So what happens is you can't get the nutcracker effect, or you have a disintegrated inner unit. That will destabilize the SI joint. Also, lifting with bad technique can wear the ligaments out. So people whose hamstrings are too tight, bending over, for example, or yoga people that don't realize they have tight hamstrings and pulling their legs up behind their head, the hamstrings are so big and strong that they will actually overstretch the sacroiliac and lumbosacral ligaments, leading to SI joint dysfunction. I've seen many cases like that. So what we do with this exercise, developed by Richard DonTigny, who I've actually taken training from and is one of the world's leading experts on the SI joint, is we can use this exercise. So we'll I'm going to show you how we do it. Here, we're going to lay on the mat. You're going to have one leg long. So I'll just put this guy beside me. We're going to start by doing the right side. So your working leg is going to be bent. Your free leg is out long. And so now what we're going to do is we're going to just gently put pressure on the heel. About enough pressure to squash a marshmallow, no more. If you overdo it, the muscle contraction will pull the two halves of the pelvis together, which will lock the joint so you can't mobilize it. Now, to help you understand what we're going to do, well, I'll show you. We're going to press on the hamstring. Let your muscles relax. Put your fingers on your hamstring and just a little pressure into your heel till you feel the hamstring fire. Then while you've got some pressure on the heel, project your knee forward. Don't go so much to roll yourself over. Just, if I had it half an inch there or an inch, just pressure on the heel so the hamstring fire, project that forward. So what's happening is we're actually rolling that pelvis posteriorly by using contraction from the hamstrings and leaving the rest of the muscles relaxed. And we'll hold that for 5 seconds and then we'll relax for 5. It's very important to completely relax for 5. Then we'll put pressure on the heel till we feel the hamstring fire. Then we'll project that knee forward as much as we can without forcing it. And we'll hold that for 5. And then we'll relax for 5. Then we press on the heel, squash the marshmallow, project the knee forward. Be careful not to turn other muscles on. Hold it for 5 and relax. Then you would switch legs. Now it doesn't matter, even if the other side's working fine, it's okay to do it because the system, once it reaches natural tension, can't be made tighter anymore. The ligaments are very strong. So if you're not sure exactly what the mechanical status is, i.e. you're a skilled therapist that knows how to assess it, there's no problem doing it on both sides because it can't hurt you is what I'm saying. You can't go wrong really. This is a very simple, gentle exercise and the ligaments are so strong, but if it's unstable and loose, this will bring it back into balance to the degree that it can with, in other words, if there's not other factors blocking it, which would be too complicated. But this is a very powerful, very effective exercise. So then you do the same on the other side. Put your hands on your hamstrings, press on the marshmallow, project the heel as far as you can without forcing it. You'll feel your anterior superior iliac spine rotating that way. That. But what's happening actually is this. When you push down on the heel, your leg's bent here, your heel's over here, the hamstrings turn on and it posteriorly rotates the ilium. As you reach with your knee, it actually causes the ilium to go back even further. Because the hip is not in the center, it's forward. So when you project your knee forward, it has the effect of that. It makes this rotate back. So when the ischium rotates back, it goes further away from the sacrum, which has a tightening effect on the sacroiliac ligaments. So as you're rotating this backwards, these ligaments, the sacrotuberous ligament and the sacrospinous ligaments are tightening. Once they reach optimal tension, you won't be able to tighten them anymore. So you can't do too many of these. You're not going to get hurt doing it. And if the other side's already stable, or either side, it'll only work on the side that's loose. So that's basically what's happening. And countless is the number of people I've helped with this. But that said, it will help. Now, if you you notice it improves it, but you continue to have SI joint pain, you're probably going to need to get an SI joint belt, which is a special belt that wraps around your hips like this, and it creates hoop tension to hold the two halves of the hemipelvis together so that you can take the pressure off the ligaments in the joint, let it heal, and then as you heal, you can back the pressure off, and eventually you don't need it, but you do need to do stabilization exercises and core work, which all Chek professionals are trained to give you based on a skilled assessment. So you do typically 3 to 5 contract, project, relax, wait for 5 seconds. So 1 contraction, 1 5-second relax would be 1. Typically you do 3 to 5 on each side, and you do up to 5 times. So 5 on, 5 off for 5, 3 to 5, 5 on, 5 off, 3 to 5, back and forth 3 to 5 times, or until you feel the greatest amount of relief or that it's not doing any more. But generally it doesn't take more than 5 rounds of 3 to 5 times 5 on, 5 off. So you could do 1, 2, 3, 4, 5, relax, 1, 2, 3, 4, 5, relax, 3 to 5 times, do the other leg, come back, do it again, come back, do it again, come back, do it again. That would be 3 on each side. So those are the tips that I wanted to share with you. It's a simple, powerful exercise that has helped me get a lot of people out of pain. As I was sharing in the beginning, there's many things that can cause SI joint dysfunction and pain. So the exercise may alleviate the pain, but it won't tell you exactly what's causing it. And it could be internal. It can be, I've seen a number of cases where the root cause was psychological, such as people having insecurities and issues and self-judgments around sex, blocking the flow of energy, leading to a musculoskeletal dysfunction that mirrors their internal psychic state. I've seen issues of cancer and things like chronic constipation and parasite infections and fungal infections and surgical scars and visceral adhesions and a lot of things. So it is fairly technical, but if this exercise helps to give you some relief, at least until you can get some skilled help with an assessment from a Chek professional or someone that really knows what they're doing. Okay, so thanks for joining me today. Hope you enjoyed practicing the DonTigny Knee Reach. Very powerful, simple exercise. If you want to learn more about this kind of corrective exercise, you can look at the prerequisite courses: scientific back training, scientific core conditioning, and program design, which get you to the Chek advanced training programs, which starts with integrated movement science level 1, previously exercise coach, and then from there you learn more and more assessments and more corrective exercises, mobilization, stretches, assessments, and we just keep doing that for 4 years. And that's the Chek Academy, along with the holistic lifestyle coaching and PPS success mastery training is the academy. So lots to share, lots of ways to help people. If you enjoy helping people and it's something you want to do for a living, then we'd love to support you in that dream. Thanks for joining me. I'm Paul Chek.